All right, let's talk about a massive bet Novartis is making, a bet that could totally change how we approach heart disease. Let's get right into the story behind this huge deal.
Check out this number, $1.4 billion. Yeah, you heard that right. That's what Novartis just shelled out to acquire Tourmaline Bio for a single drug that's still in development called pacibekitug.
So, why on earth would they spend that much? Well, it's because they're making a huge play against a problem we all see in our patients, that stubborn residual inflammatory risk in ASCVD that hangs around even when lipids look great. So, what's the drug's secret weapon? It's all about taming a specific culprit in our bodies, the pro-inflammatory cytokine known as interleukin 6 or IL-6. The thinking here is actually pretty straightforward. We know IL-6 is a key driver of the inflammation that fuels ASCVD progression. So pacibekitug, which is an antibody, is designed to just, well, get in there and block that pathway. It's like putting up a roadblock on the inflammation highway.
Okay, so the mechanism makes sense on paper, but does it actually work? Well, the proof, as they say, is in the data, specifically from the phase 2 Tranquility trial.
And the results? Honestly, they're pretty jaw-dropping. Pacibekitug just crushed C-reactive protein levels, our go-to biomarker for this kind of inflammation, slashing them by up to 86%. Compare that to placebo, which only managed about 15%. I mean, that is a massive, massive signal.
You know, the biotech's own description pretty much says it all. They called it a rapid, deep, and durable drop in CRP. When you see those three words together, you know you're looking at something potentially special. So what does $1 billion bet and data like this really mean for the future? Well, it could be signaling a whole new era for how we treat atherosclerotic cardiovascular disease. Think about it. For decades, our playbook has been all about lipids and blood pressure, and for good reason. But this deal, it really forces us to ask a critical question. Is directly going after inflammation the next major breakthrough we've been waiting for in managing ASCVD? Something to think about.